Hello and welcome back to our health channel. We are glad you are here. Today we are going to be talking about pancreatic cancer. Pancreatic cancer is a type of cancer that begins in the tissues of the pancreas, an organ located behind the lower part of your stomach. The pancreas plays a vital role in digestion and hormone regulation, producing enzymes that help break down food and hormones such as insulin and glucagon, which regulate blood sugar levels. Types of pancreatic cancer. Adenocarcinomas. These are the most common type of pancreatic cancer, accounting for about 90% of cases. They typically start in the cells that line the ducts of the pancreas. Pancreatic neuroendocrine tumors. These tumors develop from hormone-producing cells in the pancreas called islet cells. They are less common but tend to have a better prognosis compared to adenocarcinomas. Acinar cell carcinomas. These rare tumors develop from the cells that produce digestive enzymes in the pancreas. Risk factors. Smoking. Cigarette smoking is one of the most significant risk factors for pancreatic cancer, with smokers being about twice as likely to develop the disease compared to non-smokers. Obesity. Being overweight or obese increases the risk of pancreatic cancer, possibly due to the associated inflammation and insulin resistance. Age. The risk of pancreatic cancer increases with age, with most cases diagnosed in people over 65 years old. Family history and genetics. Individuals with a family history of pancreatic cancer or certain genetic syndromes, such as hereditary pancreatitis, Lynch syndrome, or familial atypical multiple mole melanoma, FAMMM, syndrome, have an increased risk. Chronic pancreatitis. Long-term inflammation of the pancreas, often due to heavy alcohol use or other factors, can increase the risk of developing pancreatic cancer. Diabetes. New-onset diabetes, especially if diagnosed later in life, may be an early symptom of pancreatic cancer or a risk factor for developing the disease. Symptoms. Jaundice. Yellowing of the skin and eyes due to the buildup of bilirubin when the cancer blocks the bile ducts. Abdominal or back pain. Pain in the abdomen or back may occur as the tumor grows and presses on nearby nerves or organs. Unexplained weight loss. Significant and unintentional weight loss can occur as pancreatic cancer affects the body's ability to digest and absorb nutrients. Loss of appetite and nausea. Digestive problems caused by pancreatic cancer can lead to a decreased appetite and feelings of nausea. Changes in stool. Light-colored, greasy, or floating stools may occur due to problems with fat digestion. New-onset diabetes. In some cases, pancreatic cancer can cause diabetes or worsen existing diabetes due to the tumor affecting insulin production. Diagnosis. Imaging tests, CT scans, MRI scans, and endoscopic ultrasound, EUS, are commonly used to visualize the pancreas and surrounding structures and identify any abnormalities. Blood tests. Elevated levels of certain substances in the blood, such as carcinoembryonic antigen, CEA, and CA19-9, may indicate pancreatic cancer but are not definitive diagnostic tests. Staging. Staging helps determine the extent of the cancer and guides treatment decisions. The TNM staging system classifies pancreatic cancer based on the size of the tumor, T, whether it has spread to nearby lymph nodes, N, and whether it has metastasized to distant organs, M. Treatment. Surgery. Surgical options may include the Whipple procedure, pancreaticoduodenectomy, distal pancreatectomy, or total pancreatectomy, depending on the location and stage of the cancer. Chemotherapy. Drugs such as gemcitabine, nab-paclitaxel, 5-fluorouracil, 5-FU, irinotecan, and oxaliplatin may be used to kill cancer cells or slow their growth. Radiation therapy. High-energy beams are targeted at the cancerous cells to destroy them or prevent their growth. Targeted therapy. Drugs that specifically target cancer cells or their supporting structures, such as erlotinib or cetuximab, may be used. Immunotherapy. Drugs that help the immune system recognize and attack cancer cells, such as pembrolizumab or nivolumab, are being investigated for the treatment of pancreatic cancer. Prognosis. The prognosis for pancreatic cancer is often poor, with a 5-year survival rate of around 10% for all stages combined. However, survival rates can vary widely depending on factors such as the stage of the cancer, the effectiveness of treatment, and the patient's overall health. Prevention measures. Avoid tobacco products. Smoking is one of the most significant risk factors for pancreatic cancer. If you smoke, quitting can significantly reduce your risk. Avoiding exposure to secondhand smoke is also important. Maintain a healthy weight. Obesity is another risk factor for pancreatic cancer. Adopting a healthy lifestyle that includes regular exercise and a balanced diet can help you maintain a healthy weight and reduce your risk. Limit alcohol consumption. Heavy alcohol use can increase the risk of chronic pancreatitis, which in turn is a risk factor for pancreatic cancer. Limiting alcohol consumption to moderate levels or avoiding it altogether can help lower your risk. Eat a healthy diet. Consume a diet rich in fruits, vegetables, whole grains, and lean proteins. Limit your intake of red and processed meats, as well as foods high in added sugars and unhealthy fats. A healthy diet can help reduce inflammation and maintain overall health. Limit exposure to chemicals. Occupational exposure to certain chemicals, such as those found in pesticides, dyes, and chemicals used in the dry cleaning and metalworking industries, may increase the risk of pancreatic cancer. Minimize exposure to these chemicals whenever possible. Manage chronic conditions. Chronic pancreatitis, diabetes, and certain genetic conditions can increase the risk of pancreatic cancer. Work with your healthcare provider to manage these conditions effectively through medication, lifestyle changes, and regular monitoring. Undergo regular health screenings. While there are no standard screening tests for pancreatic cancer in the general population, individuals with a family history of pancreatic cancer or certain genetic syndromes may benefit from specialized screening programs. Talk to your healthcare provider about your risk factors and whether screening is appropriate for you. Consider genetic counseling and testing. Individuals with a family history of pancreatic cancer or certain genetic syndromes associated with an increased risk of the disease may benefit from genetic counseling and testing. Identifying genetic mutations early can help guide screening and preventive measures. Stay informed and advocate for research. Stay informed about the latest research developments in pancreatic cancer prevention and treatment. Support organizations and initiatives that fund research into better understanding the disease and developing more effective prevention strategies and treatments. Maintain good overall health. Taking care of your overall health can help reduce your risk of pancreatic cancer and other diseases. Get regular exercise, prioritize sleep, manage stress, and avoid harmful behaviors. While it's not always possible to prevent pancreatic cancer, adopting healthy lifestyle habits and minimizing exposure to risk factors can help reduce your overall risk. If you have concerns about your risk of pancreatic cancer or would like personalized guidance on prevention measures, consult with your healthcare provider. Research and advances. Ongoing research aims to improve early detection methods, develop more effective treatments, and better understand the underlying biology of pancreatic cancer. Advances in areas such as genomic sequencing, targeted therapies, and immunotherapy offer hope for improved outcomes in the future. Understanding these details can help individuals recognize potential risk factors, symptoms, and treatment options associated with pancreatic cancer and empower them to seek timely medical evaluation and care. Thank you for watching. Don't forget to subscribe for more health topics.